Hello, everybody. Welcome to VSurf Canada's new Community talk show. My name is Tracy. I work as a program coordinator at VSurf Canada, and I'll be the host for our talk show. Now, I know a lot of people are curious to see what the show will bring, and I am equally as excited to welcome you all to the launch of our new series, Youth and Mental Health. This will be a 10-week, 10-episode series dedicated to raise awareness and end the stigma against mental health for youth across the globe. Each week, we will be discussing a different topic that affects youth regarding their health and their well-being. We will also be joined by special guests who will share their expertise and experience with us all. For our first episode, Breaking the Stigma, we have invited Dr. Sujoy. He is a psychiatrist and he will be helping us introduce the topic of mental health to our viewers. Now, before we introduce Dr. Sujoy, I would like to invite Anu Shrivastava. She is our Executive Director of VSurf Canada and will be sharing a few opening words. Anu, please say hi to our viewers.
Hello everyone, my name is Anu Srivastava and I'm thrilled to be part of the VSurf Canada's launch for a community e-talk show. For those of you who are unfamiliar with VSurf Canada, I'll give a quick overview. VSurf Canada is a federal Canada not-for-profit organization, and it was established with a vision to promote health and wellness, to create improved lifestyle, education, and need-based programs for youth, women, and seniors. These programs focus on community development, civic engagement, and workforce integration, arts, culture, and heritage to showcase diverse diaspora cultures, humanitarian and international causes. The Youth Council of VSurf Canada initiated this community e-talk series to create a safe space for viewers to listen, discuss, and learn about the mental health together. According to the Canadian Mental Health Association, approximately 20% of the Canadians will experience a mental illness during their lifetime, with 70% of mental health problems having their onset during the stages of childhood and adolescence. This means that the youth between the ages of 15 to 24 are more likely to experience a mental illness, yet this group of individuals are not receiving the necessary support to guide them onto a path of recovery. The biggest contributing factor to this is because of the stigma towards the mental health and well-being within the society. It has been deemed as a taboo topic, and those affected must overcome the obstacles on their own. VSurf Canada recognizes the value of making mental health an ongoing conversation to help normalize it and encourage those experiencing difficulties to reach out for help when needed. We hope that through these series, youth across the globe will have a safe place to talk about mental health. Let us come together, raise awareness, and end the stigma together. Thank you.
Thank you, Anu. That was a great introduction. We're now going to head over to our news corner, and I'm going to pass it off to Justin, who is our marketing assistant at VSurf Canada.
Stigma is the biggest reason why people do not go to the ER, says Sharon McKenzie, the outreach street health nurse in Nova Scotia. She adds people that really weren't accessing health care, or people that had infections for a prolonged time, or people with mental health and substance use disorders weren't accessing treatment. And that is why she decided to reach out herself and treat vulnerable people reluctant to get medical attention. In other news, a research conducted by World Health Organization shows that terms like substance abuser encourage bias and negative attitudes. So understanding how language can influence our perceptions is an important step in reducing the stigma with multiple mental health issues, and in turn reducing the barriers towards individuals seeking treatment and recovery. Moving further, art is being used to end the stigma of mental health. How, you may ask? Well, a new art sculpture supporting mental health was unveiled in the Blue Mountains, Ontario last Wednesday. Canadian artist Charles Patcher created the maple leaf art installations for a national mental health fundraising campaign. These sculptures have been installed at prominent locations across Canada, and this campaign ends on World Mental Health Day on October 10th. If you'd like to donate to this campaign or if you want to read about these articles in depth, you can go to our social media channels and find links to all these articles in our social feed. Now, to dive deeper into this topic, let's invite Anu back to start an open, unplugged discussion alongside our special guest of the week.
Hello again. We're talking about breaking the stigma on mental health issues. Now, if we were to talk about the definition of breaking the stigma, what does that really mean? I think it's a mark of disapproval, which results in an individual being rejected, maybe discriminated or excluded from participating in a number of different areas of the society. So we can say that stigma really simply means an individual is affected in a negative way. So what can we really do to reduce the stigma associated with mental health issues? I think there are 7 things that we can really do to reduce the stigma, and I'll run through them really quickly. First of all, we should be really open and talk openly about mental health issues. Secondly, we should be aware of our attitudes and our behavior and show compassion to people. Thirdly, we should actually choose our words really carefully, which means that we should be conscious of the language that we are using. Then we should know the facts. When we say know the facts, we really need to not only educate ourselves, but we can educate others through that as well. Then we should really encourage equality between physical illnesses and mental illnesses. I mean, why should there be any difference between the two? And we should be talking openly about either of them. And we should also focus on the positive and try and support people as much as possible. And lastly, I think we should be really honest with ourselves, and when there is help that's needed, we should actually take the help and go to the experts. So now we are at a point when we're talking about the experts that we have a very, very special guest with us, and I'd like to introduce you all to Dr. Sujoy Ray, who is from United Kingdom. He's a psychiatrist, and he's not only a clinician, but he's also a medical teacher, and he is a researcher. He's extremely passionate about evidence-based medicine and the use of technology in the medical science field. During the COVID era, in these past year or so, when mental illnesses have been on the rise and the help to the affected people could not be delivered in a face-to-face situation, he has been actually holding innumerable online sessions with people in need of such help in the form of counseling, as well as guiding the family physicians and other health workers. So I'm very happy to welcome our medical specialist for today, Dr. Sujoy Ray. Welcome to the show.
Hello.
How are you?
Yeah, I'm fine. I'm fine. How are you?
Oh, I'm good. I'm good. You've joined the whole team. How's UK?
Yeah, it's good. It's good.
So, Dr. Sujoy, I am going to start with the questions. We have 4 questions, and the first question is that what does stigma really mean from a medical terminology point of
Stigma
view?
is like the kind of the attitude or the feelings that a person has towards something, some aspect. It could be towards a person, it could be towards a tradition, it could be towards anything. I believe this term used to come from branding, like you brand certain people as something. If he is this, he should be that. That kind of a thing. That's where this word has its origin. But in general, it's a sort of a attitude which the people have, or mostly it's a negative thing. It's not a positive thing that if he is this, so he must be dangerous, and if you know that kind of a thing. So that basically what stigma means in a very general sort of a term. Yeah.
Actually, this really leads to my second question, which is really what we want to talk about is that why is mental health stigmatized? Like, basically, you always, I mean, people shy away if they have any mental health problems. They don't want to come out in the open. And exactly like you said, like people have that negative feeling whenever
Mhm.
they are talking about mental health. So, what is the reason why mental health has this stigma?
Yeah, so I think it's because mental health is a little bit less understood, although things are changing now, but mental health is little less understood as compared to physical health. Many, I mean, mental illnesses, if you see, sometimes it's difficult to pinpoint what is the problem. Like in a physical illness, you've got a pain, say, let's say you have a fracture and you have pain, and you can show people, look, his bone is broken, and that's why he's having this pain, or look, there is this problem in his blood, and that's why he's having this illness. Mental illness, it's not so clearly, it is not very easily detectable. In fact, there are no asset scans, tests, or reports which concrete things which people can be shown. So many people think that they are just acting, or this illness doesn't exist, it's a doctor who's making it up. So it's difficult to uh, prove to people or to make people understand. That's why they tend to, if you can't see something, then the people form their own opinions and they stigmatize the particular issue. So I think that it's because of the difficulty in the proving the mental illness, bringing it out in front of people. That's difficulty is the reason why there is so much stigma, I would say.
But I'll just go back to it might sound very pseudo, but it is like, when people, like, usually when they talk about mental health, they say that, it means like you're crazy, like
Hmm.
basically you're cuckoo in your head. That is what the feeling is. So I think, I mean, in a layman's term, that's probably why it is so stigmatized, as I think, is because how people they generally think that anybody who's got mental health, they just relate it with that fact that this person's crazy, or he doesn't know what he's doing.
Hmm.
So that uh, kind of leads to the next question, which is like, what how does that impact the society in general?
So
Like,
right. So I mean, there are two things. So if people do not accept mental illness, first of all, it impacts the patients. So anybody who has a mental illness, which is quite a, I mean, it's quite a common thing. It's not very uncommon now to have a mental illness. So lots of these, all those people who have mental illness, they suffer. I mean, not only because of the illness, but also because of the stigma. And since there is the stigma, then there is delay in seeking treatment. There is delay in giving them relief, or understanding them. So their lives are worsened. Many of them would end up, in worst cases, they'd end up committing suicide and things like that. And so that impacts that entire section. It's an injustice to that entire section of people who are suffering from mental illness and their families as well, because their families and, I mean, families, friends, whoever it is, support system has to bear the whole brunt. They
right,
are also stigmatized along with them, that it's because of you that he is like this, and that kind of a thing. So this will impact the society because it takes away this section of people who could have otherwise been very productive had they been treated well, cared for well, and their families as well. So it's depriving the society, it's depriving a nation, or whatever the economy of a nation. You lose the productivity, and those people ultimately end up being a burden on everyone else, just because they had to undergo, they had to face the stigma. Otherwise they could have done really well. They would have been an asset to the society had they been had they been treated well, and had they been given the required compassion.
okay. No, that's really so good to hear explained like that. I would also like to actually ask that how can you actually reduce the impact of this phenomena, if I can put it that way?
So the main thing here is education. I mean, education about mental illness, what I was saying, I mean, whatever is lacking, as I said earlier in the first question, that in the initial earlier question, that we don't understand how mental illnesses happen. Even mental health professionals are, a lot of research is going on, that how exactly what part of the brain is affected in, say, depression, or what part of the brain is affected in some other disease. So even mental health professionals are always researching, so the general public has even lesser knowledge. So to make people understand, if we can make people understand how mental illnesses occur in a simple language without the medical jargon and things like that, so if we can make people understand and appreciate, and then tell them that how it impacts, and what would happen if you do not treat them, what would happen if you stigmatize them. So if that education can be given to the public in general, and especially more to those people who are involved with mental health patients, like other doctors, nurses, and other healthcare professionals, that is the only thing. Because if people understand, it's not that, I mean, I would like to think that people are not doing this deliberately. They don't know what they don't know, they will fear. So if you don't know something, you'll always be afraid. But if you have the knowledge, if you understand, it's still a serious issue. Mental illness is a serious issue, but at least people will not be afraid of it, and they'll be able to help. So education and knowledge is the only way. I mean, it's actually the major way in which I can see how we can combat stigma, and this has to be done at all levels, whether local level, national level, programs, the required economy, the funding, and all those things must be done. But yeah, overall, the need is education and knowledge about mental illness.
Thank you so much for that, Dr. Sujoy. You know, what you've said is that there is a need to educate everyone. And that's why we, as We Serve Canada, are really so proud to say that this is a small initiative that has been taken on behalf of our community to educate our people, to raise the awareness, to make sure that nobody is stigmatized, that people live positively, and they enjoy good mental health. And I would really like to thank you, Dr. Sujoy, for coming to our show and being part of this candid conversation. And there's many more to come. And I know that you will be participating in some of our other conversations as well. And I really look forward to having you there again. Thank you so much.
Thank you for giving me this opportunity, and all the best to all of you. Thank you so much.
Thank you so much, Dr. Sujoy. What you've said is so true, that there is a need to educate everyone. And that's why we at We Serve Canada are so proud to say that we've started this small initiative that has been taken on behalf of our community in Toronto to educate our youth, our women and children, our seniors, to raise the awareness on good mental health. And to make sure that no one is stigmatized due to ignorance, and people think positively and support each other and enjoy good mental health. I would really like to thank you, Dr. Sujoy, coming to our community e-talk show, sharing your expertise in the form of the candid conversations. As you know, we are doing this as a 10-part series, and we have more talks coming up. And I know that you're going to be part of our next conversation, recognizing the warning signs of mental health issues. I really thank you again for coming forward with participating with us. And I really look forward to talking with you again next week. Until then, stay safe, everyone.
And that wraps up this week's episode. Thank you again to Dr. Sujoy, who joined us and shared such a valuable insight on our topic of youth and mental health. Stay tuned, everyone, for next week's episode. It's called Recognizing the Warning Signs of Mental Health Issues. Now, don't forget to give our video a like and comment down below to ask any questions that you may have. To show your support for our new series, please subscribe to our channel and hit the notification bell button too. That way, you'll always be updated the moment our next episode is released. Also, don't forget to check out our social media handles to be part of the loop and see all of our events. See you next week. Bye!